The CDC's cuts to FoodNet could threaten Americans' health. This is an issue that experts say could keep us from catching foodborne illnesses before they become serious. FoodNet, short for the Foodborne Diseases Active Surveillance Network, is the nation's most comprehensive system for tracking the pathogens that give millions of people digestive problems each year. For years it monitored 8 different bacteria and parasites. This summer the Centers for Disease Control and Prevention quietly scaled it back to just 2. That means that Listeria and Vibrio, once among the main culprits, are no longer tracked. What does that look like? FoodNet runs on a partnership between 3 federal agencies and 10 state governments. They coordinate to spot infections early and dig into where the foods come from. The CDC says it has other programs that also keep an eye on foodborne illnesses, so the idea is that we don't lose all protection. But public health experts argue that those other systems aren't as thorough, and they miss many cases that FoodNet would catch. Dr. Glenn Morris, a physician and epidemiologist in Florida who helped establish FoodNet, says, "You will clearly miss cases." That loss isn't just an abstract concern. The pathogens being cut, especially Campylobacter and Listeria, caused 72 deaths in non-2022, and sickened thousands more. Other cut pathogens include Cyclospora, Shigella, Vibrio, and Yersinia, each a potential hazard. A CDC spokeswoman noted that some of FoodNet's processes are duplicative, meaning other agencies already track these illnesses. She highlighted that the 2 pathogens the program will keep an eye on, Salmonella and the E. coli strain known as Assisi, are among the biggest contributors to hospitalizations and deaths. Still, she added, the system's broader reach is unmatched. Yet, as Gavin quoted, we're really gutting one of the cornerstones of food safety. Elaine Scallon-Walter, a professor of epidemiology who led FoodNet research in Colorado, agrees. The program's breadth allowed the CDC to gather data on how many people are affected, how the illnesses spread, and what foods are most likely to trigger them. Removing those lines of sight could leave us blind to emerging threats. The timing isn't incidental. U.S. residents are growing less confident in the safety of what they eat. A recent survey of 3,000 Americans found only about half feel very confident or somewhat confident in the food supply, down from roughly 3/4 in 2012. Nancy Glick, Director of Food and Nutrition Policy at the National Consumers League, sees the cuts as adding pressure on consumers who are already freaked out. People can still be careful, cook meats thoroughly, wash hands, wipe surfaces, but those measures don't protect against pathogens that spread via undertracked routes. That's why some fear the CDC's decision could deepen a fragile trust in our food system. The bottom line, FoodNet's departure from its full scope means more infections could slip past notice, and more people might become sick or worse. Public and private actors alike will need to step up to close those gaps. Thank you for listening. Stay informed choreography about the foods you eat, and stay tuned for updates on how the CDC's diagnostic strategies evolve. Until next time, take care of your health.